As a reminder, everyone's microphones are muted so that there's no background noise during the presentation. We ask that you use the Q&A feature to submit any questions you may have. If we have any follow-up or need any more information, we'll be able to unmute you. This event will also be recorded, so if you miss anything or want to share it with anyone post-event, you can do that. And as a reminder, these events are not just for Rutgers alums, so if you ever get an invitation for a topic that you know someone might be interested in, we ask you to please forward them the invitation. So now I would like to introduce Kenneth Sebastian León, Assistant Professor of Latino and Caribbean Studies and Criminal Justice at Rutgers University, New Brunswick. He specializes in corruption and state corporate crime, racialized social control, and is author of Corrupt Capital: Alcohol, Nightlife, and Crimes of the Powerful. Prior to joining the Rutgers community, he was a visiting assistant professor of sociology at George Washington University and a research contractor at the U.S. Department of Justice, National Institute of Justice. Immersive projects and justice systems research include studies of the Colombian National Police, the Honduran National Police, and the transnational capacity of MS-13 in the United States and El Salvador. Current collaborations include COVID-19 and Immobility in the Americas, a project which examines the transnational impacts of COVID-19 on measures and processes of racialized social control, migration, public safety, and human rights. More information about the project can be found. I'll put the link in the chat, or in the chat. Dr. León will share findings from a study funded by the RU Center for COVID-19 Response and Pandemic Preparedness, where he and his colleagues Ulla Berg and Sarah Tosh examine how migrant detention and deportation serve as vectors for COVID-19 transmission. Drawing from original data specific to Bergen, Essex, Hudson, and Union counties, he will also discuss how COVID-19 has magnified ethical and logistical issues with ethnographic inquiry and justice systems research. Please join me in welcoming Dr. León.
Good morning and good afternoon. My name is Kenneth Sebastian León, and it is a privilege to be able to connect with you through the Scarlet Speaker Series. I want to thank Dana and Christina for making this gathering possible, and Tom as well. And I also want to thank each of you for sharing your time with me. Now, at this moment, you should be able to see my screen. And let me just put this in presentation mode. Wonderful. Okay, so just as a brief overview of the presentation, the format is 60 minutes long, and really the first half is where I'll be presenting these slides, and really the latter half is the most valuable part for me, which is having the opportunity to engage with questions, comments, critiques, and other inputs that we might have as a collective. So this presentation will contain findings from an ongoing study conducted by myself and a phenomenal interdisciplinary group of scholars and students that are based in the Rutgers community. The presentation is divided along the following categories. I'll provide an introductory narrative to connect COVID-19 to pressing conceptual dilemmas about mobility, governance, and inequality. And I'll then describe the research we're doing and how we're doing it, followed by a brief sampling of our findings. I'll then give some key takeaway points and outline where we're going with this work and the opportunities for potentially collaborating. These slides are available upon request, and for that reason, you'll see my email address in the footer section below, along with the slide numbers for a more convenient Q&A or a separate email follow-up, should you choose to do so. So this presentation contains only one presenter, but every single thing about this project is made possible only through the collective effort of this 5-person team. The professional experience and the skill sets represented among this group have fueled the success of this project and the content that I'll be presenting here. I'm very privileged to be working alongside these members of the Rutgers community, and for that reason, I want to give a public shout out to Ula, Sarah, Gabrielle, and Milani. So in getting right to it, New Jersey, as many of us know, is part of a densely populated region in the United States with geographic, economic, and social proximities to the formal jurisdictions of neighboring states. New York, Connecticut, Pennsylvania, Maryland, and so on. And New York City in particular looms large in shaping how life is patterned in the state and shapes the mobility patterns and practices affecting everyday life for those in New Jersey. As a result, when New York City became the epicenter of the coronavirus in the United States, the ripple effects and aftershocks are deeply profound and still with us to this day. For those who, like myself, may have been born in other countries or have immigrated to the US at a young age or thereafter, we're very familiar with an assimilationist or kind of in a positive way, thinking of the way that the US culturally portrays itself as being quote unquote number one or being quote unquote the best. And so there are some indicators that complicate this narrative or that show what it means to be number one, but just in a dismal context. So the United States is number one in terms of having the highest known number of COVID-19 cases in the world. The US is also number one in incarcerating the greatest share of its citizens and residents in the world. And the US has the largest numbers of migrants in detention, where in our current context, social distancing is impossible, and where the detained lack access to defensible sanitation, hygiene supplies, and medical care. In the state of New Jersey specifically, the counties of Essex, Bergen, and Hudson are the three counties with the largest total confirmed COVID-19 related deaths in the state. So in this context, being number one sucks. It's not the number one indicator that we'd like to have. As an airborne pathogen, COVID-19 presents additional challenges for those who are in tight quarters or what we can just call confined space. And as we saw in the earlier phases of the pandemic, cruise ships and other naval vessels, along with nursing homes and meatpacking facilities, are examples of where the architecture of a given place is especially challenging for a virus that is easily transmittable via airborne particles. And of course, what we're talking about today is about correctional facilities, which capture or refer to prisons, jails, and detention centers. But before we talk about these places in particular, I just want to zoom out for a second and reflect on mobility controls in the first place. Through one line of reasoning, and it's kind of an interpretive frame that we can put on for a second, restricting one's freedom of movement is inherently bad. It limits the freedom of individual people to exercise agency and go where they would like to go. And so to restrict a person's mobility, it must be justified or defended on some articulable grounds, or there should be some reason ideally for why it would be justified to restrict someone's mobility. In other words, there must be a reason. So when I use a phrase like restricting mobility or mobility controls, this can refer to things like mandatory quarantines and isolation periods, the closure of international and regional borders, the use of curfews that regulate the nighttime economy, and so on. And while this might seem like an abstract or armchair type of reflection, this, the sort of essence or the conceptual core of having mobility restricted is kind of what is at the forefront of both toxic political discourse and reasonable policy debates alike. People generally dislike being prevented from moving across geographic space. But mobility controls do not solely refer to preventing people from moving about. It can also look like something slightly different, which can include the surveilling, the tracking, the capturing, the arrest, and the detaining and forcible expulsion of human beings across geographic space and across international space. And it is here where I want to briefly articulate what it means for our project to kind of push back against pandemic research exceptionalism, This is kind of a loaded term that simply underscores the fact that much of what we're discovering and seeing, both in academic settings and in the real world, is that COVID-19 has not brought unknown particles from outer space that slammed into the earth and brought all of these new issues and new functions that were heretofore unprecedented. Instead, we're finding that COVID-19 is accelerating or magnifying pre-existing inequalities and systemic harms. In other words, what we're seeing is how pre-existing systems and processes are affected by a novel coronavirus, and not about how a novel coronavirus generated entirely new systems or institutions. So much of what we've studied and what we're looking at are things that predate the pandemic, but which look particularly injurious during a pandemic. So one framework, and to be upfront about it, is the interpretive lens in which we examine this is COVID-19 as an inequality magnifier and a state crime accelerator. And we'll refer to these two simultaneous themes near the end of the presentation and hopefully in the Q&A. In coming back down to the narrower focus of how this project came about, in the spring of 2020, Drs. Berg and Tosh, along with myself, secured funding from the newly established Rutgers Center for COVID-19 Response and Pandemic Preparedness. Those are a lot of syllables, so the acronym is much appreciated. CCRP2 is the name of the center. And we're asking two very direct questions. Number one, what are the relative best and worst practices for addressing COVID-19 modifications across detention centers and other carceral facilities in New Jersey? And then two, what role do US immigration and criminal justice policy have in either supporting or undermining an effective pandemic response? The slides are available upon request, and so to maximize our time, I have a, pardon me in advance, it's a somewhat corny heuristic, but we can use the number 6 and count down from there down to 1 to just summarize the research design and make it pretty straightforward. So starting from the top, we focus primarily on the 6-month period between March and August of 2020. The research team consists of 5 people with our identities and affiliations on slide 3, which we've already covered. We're looking at 4 detention facilities, and our unit of analysis is at the level of the facility, spread across 4 counties, Bergen, Essex, and Hudson County, and then Union County, which is where the Elizabeth Detention Center is located. All 3 counties, either currently or previously, have intergovernmental service agreements, or IGSAs, with Immigration and Customs Enforcement, or ICE, to detain migrants on their behalf. We have 3 data collection methods, one of which is a semi-structured interview instrument, and exhaustive content analyses of all available literature on these facilities, and the creation of a secondary database repository for quantitative analysis and evaluation. In working our way down, we have 2 primary field workers, or at minimum 2 of the co-PIs, or the research faculty, who have gone out in the field to observe public meetings, protests, and informational sessions that involve these facilities. And then last but not least, we have 1 funding source for this project. This slide, to be totally transparent, was really more for me than for you in the beginning. I'm new to New Jersey. Nothing makes sense to me yet, not the relation of where the counties are to each other, nor do the highways. Is it going east or west? Who knows? What is the 287? Where does the 18 and the 27 end? These are questions beyond the scope of our presentation, but they stress me out. And so this slide was a way of decreasing that stress and kind of visualizing and putting on a map, if you will, what it is that we're doing and why we selected the counties that you're hearing in this presentation. The research fits within a wide span of literature found in criminology, sociology, migration studies, ethnic studies, history, and so much more. We don't have time for a formal literature review, nor is this medium the best place to get into the weeds of who we cite and how and what theoretical framework we use and what traditions they pull from. I'd be happy to share kind of more substantive information about this in the Q&A, but I'm including this here in case there are specialists who want to know the literature that we're engaging with and the subfields and disciplinary perspectives that we pull from. So in getting right to it, we've had privileged access to an activist who secured week-by-week updates from contacts inside each of these facilities, Bergen, Essex, and Hudson. And the green arrow represents a reduction in the inmate population, and the red arrows represent an increase in the inmate population. The green and red are value judgments, green being generally something that's good, red being something generally that's bad. And the reason for those value judgments is in a pandemic, when you want social distancing, it's kind of like saying if there is coronavirus aboard a cruise ship, the more people and the faster you get people off of that ship and accounted for in terms of their health and physiological well-being, the better. And so that represents the justification behind the colors. The way to read this is that in between the 2-month period between April 16th and June 26th, for instance, by way of example, in Bergen County, there was a 45% reduction in the total number of ICE detainees. The non-ICE detainee population also decreased, but by 4%. And what we will see in Essex and Hudson is that the population type, if you will, the increases and decreases don't always match. And that is what we observed in Essex and Hudson. Now, the reasons why these fluctuations exist are multifaceted. We have no causal inferences or no one-size-fits-all explanation for something like this. Reductions can signal a wide variety of things. For example, release on bail, transfer to other facilities, and deportations. Union County is not here, which is where the Elizabeth Detention Center is located. That's contractually run by a group called Core Civic, a private contractor. They are extremely secretive, hard to get information from. And the information that we have been able to gather, we're still in the process of triangulating. This is very much an active project, with my colleagues having completed an interview just this morning. And as of this morning, we have 10 interviews completed to date. Those are with 2 wardens or directors of 2 separate facilities. We have 5 interviews with local defense attorneys or lawyers, 1 career activist, 1 video teleconference specialist, and 1 former detainee. In what follows, I'm going to share excerpts from our interviews with 2 wardens. Their identities and the facilities in which they work are not included so as to comply with our research protocol. And my reasoning for including the perspectives of the wardens is that, for very good reason, criminal justice systems are often discussed about in both policy-related terms and in social activism and social movement terms. And I think it's always helpful whenever possible if you can get as close to the source, if you will, and as close to those who have firsthand experience working within those systems and contexts. It can be beneficial to hear how they're experiencing it. And of course, it's super relevant to our research questions. So, in sharing some representative excerpts, one warden shared the following. My colleague and I developed a saying, "Yay, COVID." And I say that because there were some really good things that came out of COVID. The good things that came out was the fact that we no longer had to transport inmates back and forth to the courts. The courts had begun to use videos for the hearings, and they've done it a lot more. In this excerpt, when I say representative excerpt, it's our way of presenting select portions of the interview transcript in a way that captures various different other contributions that are consistent with that same theme. And in this case, the theme that we're focusing on here is how the coronavirus pandemic can present both challenges and opportunities to advance what we might call instrumental goals, or advance goals that might not have been as easier to do prior to the pandemic. This example is one of several. Another example includes closing down entirely different entry and exit points of the facility and having more stringent screening of correctional staff, which in turn reduced, as per the warden, the amount of contraband that is brought in by the correctional staff themselves. Coming back to that point about how COVID can either magnify or accelerate pre-existing inequalities, from this excerpt, we can see an example of that, and I'll read it now. Quote, "Right now, because of the budget cuts that took place over 10 years ago and the reduction of mental health facilities and term care facilities, jails have become mental crisis centers by de facto. There are no other places for these individuals to go other than jail. The jails weren't equipped to handle the pandemic that existed 10 years ago with mental health and substance abuse. So when you're dealing with a strict city environment and the close living conditions and economics, that limits the access to medical care, and jails become that urgent care. Jails and prisons are facilities that, depending on what state you're in and what county you're in, they might be the largest healthcare provider for vulnerable segments of the population. And so when you layer a global pandemic on top of that, it raises significant challenges. And on top of that, in a separate part of the interview, this warden shared with us that the role of isolation can complicate mental health challenges experienced by inmates or detainees, that being alone and isolated can make pre-existing mental health challenges far worse, which is consistent with the literature that shows all of the harms associated with solitary confinement. The data that exists in the public domain about releases and transfers require very granular triangulation. Something like the term release or the term transfer doesn't necessarily tell you exactly what happened to the human being in question and what the fate of that human being was. In this case, let me read the quote and then I'll elaborate some more. So quote, "Basically, from people who have been released from detention, it doesn't necessarily mean that they've been released to the community. It basically just means that they're not in the facility anymore." When you have a scenario where there might be a COVID outbreak in a facility, to know that there have been X releases or Y transfers doesn't necessarily tell you, again, where that person might have been, whether they've been released or what facility they might have been moved to. There are these facilities called processing centers, many of which are concentrated in the Deep South, in Mississippi and Louisiana, for example, where deportees will be sent to prior to being deported to a receiving country. And so that's been an important factor in our research. On that note of inter and intra-facility transmission of the coronavirus, I'll read, quote, "Remember, New Jersey was the first. We had the first COVID-19 case from someone from ICE. And we started seeing that first in Bergen, Essex, Hudson, Elizabeth, and then it was Buffalo. You know, all those transfers from here, it was like basically taking the virus everywhere. And it could have been from Buffalo or from Orange to Farmville. And it's just outrageous. They have about 70% of their population testing positive in Farmville." So as we approach the end of the formal slide-based presentation, there are some major takeaways that we can kind of point to. And as social scientists, we tend to hedge our claims. Academics in particular, what we specialize in best and what we're most comfortable with is pointing out all the things that we don't know and all of the things that haven't been addressed in a study and all of the things that the study didn't do in its sampling or in its measurement and so on. And that makes sense. It's our job to highlight uncertainty and the many areas of research still yet to be done, and there's always more to be done. But we do have enough information here to provide very clear points about what should and should not be done as a function of a global pandemic. You don't need too many longitudinal studies to intuitively arrive at the conclusion that there's really no such thing as a COVID-19 compliant prison or jail as they currently exist. And one way when it comes to point number 2, there's a rich literature on this that views deportations as a civic death penalty. A civic death penalty meaning you are extracting someone from the life, the family, the work, the social environment, the world that they exist in, and forcibly expelling them to a place that is not for them their home or their sort of anchor point, away from their family and away from their social bonds. And in some cases, it's a literal death penalty, but that's beyond the scope of this presentation. If we were to view deportations with that level of seriousness, and some do, some don't for different reasons, but if we did, it would follow that such actions would be appropriate only for the most severe of transgressions. And that's before we layer on top the influence and impact of a pandemic. Naomi Klein, among others, especially our colleagues here at Rutgers, have found in their own fields and sub-areas how COVID-19 accelerates various forms of inequality. In our study, we are finding how COVID-19 has prompted a more magnified erosion of due process and immigration courts. And on this last point, on it not having to be this way, it is, I mean, we are talking about something that has taken the lives of people that we know and community members that we know. And I don't want to end on a note of doom and gloom while also respecting the seriousness of this topic. What the pandemic has brought to the fore are the many pre-existing tensions and structural fissures that were already there. But if there is a silver lining, and there surely are, but for our purposes, perhaps what we've also learned is how quickly organizations and communities can rearrange their rhythms, their patterns, their expectations, and their objectives. And you know, once upon a time, there was a moratorium on the federal death penalty. And while there were no executions at the federal level, there was no negative ramification in terms of seeing any increase in heinous capital crimes. And so we can imagine a pandemic response that involves a moratorium on deportations, where we would similarly find that there are far more productive and generative ways of allocating resources that are currently being used to surveil, capture, and forcibly expel human beings. And worst of all, in the midst of a pandemic, some of which have tested positive for COVID-19, and some of which have been deported while being symptomatic with COVID-19. When I say it doesn't have to be this way, I'm not talking in the abstract. In June of this year, legislation S-4011, or the Immigration Enforcement Moratorium Act, was introduced, and it could and would have done exactly this: halt deportations during a pandemic. For researchers and activists who are interested in learning more, we do have 2 manuscripts under review for this project. We're constantly looking to scale up and connect with activists and researchers who are working in this area. And one way to share how we're thinking about this for the long term is within one presidential administration, you know, January of 2017 being the inauguration of the current president. We'll be looking at the pre and post impacts of the coronavirus on processes of migrant detention and deportation. This is my last slide, and I want to use this chart to make a concluding remark. There is a tendency in what is called crimmigration, or the literature on criminalizing migrants, that unintentionally and inadvertently organizes the incarcerated along these categories of who is more or less deserving of what's being experienced in jails and prisons. And people will vary in how they approach the ethical and moral arguments for or against both prisons and punishment. But we can also trust that people with good information will lean towards pragmatism and understand things in quite direct terms if given the opportunity to evaluate things as they are. In this case, the pie chart that you're seeing from the Prison Policy Initiative underscores my final point. It shouldn't take a global pandemic to remind everyone that there are hundreds of thousands of people who are confined in spaces that are not only maladapted to an airborne disease, but they're jailed and imprisoned for reasons that have little to do with public health or public safety, and more to do with how criminal law and criminal justice institutions, historically and today, continue to capture and confine historically oppressed segments of our society. Whether or not a pandemic is with us, we should not accept pie graphs like these as a normal state of affairs. And with that concluding remark, I want to thank you so much for sharing your time with me, and I look forward to our dialogue now in the Q&A. Thank you.
All right, thank you. So we have some pre-submitted questions, some questions that came in during your presentation. So we'll kind of flip-flop back and forth. So I have the first question. Hi, thank you so much for having this webinar today. This is an incredibly important topic. My name is Alejandra Portillos. Hopefully I said that right. I am a fourth-year PhD student at CU Boulder and currently doing research in Colorado on queer and trans Latino immigrants' experience who are detained or have been deported. Could you speak on any precarities facing queer and trans migrants within detention, and considering COVID that have emerged from your research? Sorry.
Thank you, Alejandra, for that excellent question. And you're studying something that is extremely timely, important, and an area of research that that is deeply important. So, consistent with the theoretical framing, the precarity of trans and queer and gender nonconforming communities and individuals in formal criminal justice settings is quite dire. Whether we're looking at police, courts, or corrections, there are ways that these are empirical questions, meaning that they're knowable and we can see things that predate the pandemic that would speak to the precarity that you rightly point out. In our own research, though, and in kind of keeping my responses anchored to the nature of our project, the role of gender and of kind of binary approach to sex really being where male inmates go and where female inmates and detainees go is something that we are actively teasing out and paying attention to, especially because migrant detention and deportations are gendered processes in and of themselves. And so that is a literature we engage with. As far as within the empirical domains of our own research, we don't have the data to speak to your question more directly, but it is an extremely important area of inquiry, and I thank you for asking that question.
Okay, next question. This was pre-submitted. Someone asked if you could speak on, are county contracts with private prison companies commonplace, or is that something specific to New Jersey? And they also wanted to know about isolation and prevention policies in county jails.
Yes, on that first question, so on ICE's website, or Immigrations and Customs Enforcement website, they have a list of their facilities, and ICE is present across the United States. And ICE will have contracts both with existing county jail facilities, and they'll also have contracts with private detention centers and private facilities that run separately and have no interaction with the sort of county jail, if you will. And so that would be my way of approaching the first part. The second part, Dana, could you please briefly repeat?
Yes, give me 1 second. It was more about what our county jail's doing to handle this. But you were talking about it?
Yeah. Okay. So there are some really remarkable findings that we get from what some might immediately recognize as having a small sample size. I mean, this is a case study of 4 facilities. Our unit of analysis is 4 facilities. And so what we're finding, of course, is specific to how, 4 facilities have adapted to COVID-19. Some specific ways that these facilities have changed. One includes, for better and for worse, minimizing the movement within the facility. That includes visitation, that includes legal counsel visits, that includes inmate time or time for inmates and detainees to move about in recreational space. Other examples include using an app called you really can't make this up. It's called Getting Out. It's this app that can be used through a tablet for inmates to request things like PPE, which is in short supply in these facilities. But yeah, that would be one way of accounting for how the facilities in our study have adjusted to the pandemic.
Okay, here's another question. 2 related questions, so 2 parts. I understand why reduced inmate population seems good in the abstract, but I wonder if you know what happens to the people who are taken out of these facilities. Where do they go? And does where they go provide more safety? For example, are those who are released going to homeless shelters where the spread problems might be worse? If they simply go to other facilities, how does that help? Are those other facilities safer? So let's start with that, and then I'll come back on and do part 2.
Thank you for that question. It's such an excellent one. In some ways, I'm going to dodge it, but I want to validate the importance of what the question could imply. So because our unit of analysis is the facility, in some ways, and also as per our kind of IRB framework, if you will, we don't track individual persons as they move. We focus on facility level processes. But the question that's being raised is incredibly important because it would be like asking if there is the Diamond Princess cruise ship that has a COVID outbreak, and it's in the harbor, and someone by law has to go into that cruise ship, where else could they possibly go, and will it be any better than what could be provided or what would be experienced in that cruise ship? In this particular case, of course, we're talking about a jail, and I think this raises a lot of if-then types of ways of reasoning on the question. If there is no funding and no pre-existing shelter, community center, no place to house or host an individual who must be housed or hosted, that presents some challenges for like practically addressing the exigencies of the response. So it's very important, and I want to switch to the second question that's listed there, which, what are the health data in the facilities you examine, and how do these compare with the counties in which the facilities sit? Excellent question. So one component of our study is quantitatively driven and accounts for a variety of different, we might call control variables, to be able to answer those exact types of questions. So we want to know the testing rate, we want the size of the county, the number of employees in different correctional agencies, the funding streams for different portions of the pipeline in detention and deportation. And so disentangling between infection rates, hospitalization rates, death rates are part of that wider data collection effort. I don't have those figures prepared to answer the question empirically, but the question itself is important, and we are looking at that along with other variables to kind of to really audit what's going on in these 4 counties. So thank you for that.
Okay, we'll do the next question from Anika, who said, thank you for the presentation. I'm curious about the access/trust issues that you had in terms of trying to get interviews. Can you also tell us about any preliminary results that came out of the field work? Did you say that field workers went to protests?
Anika, that is such a good and important kind of underemphasized part in, I guess, in any conversation about research methods, especially in criminology and criminal justice. There are ethical and political dimensions that are inherent to not only this topic, but the formalized study of things like these. We secured interviews with people who experience these institutions and systems in very different ways, some of which, as noted in the slides, are the wardens themselves. We have interviewed one former detainee, and there's a very delicate balancing act that is implicated here. One of the reasons why we don't share who the wardens are and what facility they specifically are associated with is because our role is not to throw the incompetencies and the kind of the shortcomings of the pandemic response at the feet of the correctional staff and administration. And criminal justice is very deservedly so a place or a series of institutions that are subject to many forms of critique. But one of our points is that criminal justice are these institutions where these harms are most salient and most visible, but they're not the originating source or the sole cause of the various inequalities that we see. Another way of flipping the response and just keeping it straight to the point is police courts and corrections could be abolished tonight. They may not exist as of tomorrow. And racial, gendered, and class-based inequality still would exist in all of its other machinations and forms. And so your question raises this very practical one of how do we adequately represent what are very antagonistic value systems in this space? And it is something that we write about formally, and I'd be more than happy to carry on in conversation post discussion. So thank you for raising that. Okay. Very briefly to, in following up on a previous question about the quantitative portion of the study, we do have numbers that show trends in where people are often sent to. That includes processing facilities and like partnerships between cities in New York and agencies in New York and New Jersey. And I would be happy to discuss that more as well offline. Thank you for that.
Okay, next question. Would you find that the perception of the relationship between COVID-19 and its spread, paired with the reasons people are being detained in the first place, are fairly dichotomous? For example, people who hold law enforcement positions tend to be generally pro-COVID because of its changes, or dehumanizers of inmates because of where they fall in our social caste system.
Thank you for that question. In our study, we find that the wardens themselves are human beings trying to make the most and trying to exercise agency, given the structural constraints and the organizational pressures and the incentives and disincentives that are in their job. Knowing full well that there are things far beyond their control, but they are responsible for, say, the operations of a facility during a pandemic. There is something to be said, though, about occupational roles and the cultures associated with them. And the brief thing that I'll offer is, in the major, like in different news outlets and in different kind of narratives, we saw examples of first responders and hospital workers in particular that would do things like, if someone was a doctor or a nurse, they would sleep in their garage because they didn't want to risk carrying the virus to their household and giving it to their family members. In our interviews with people on the ground and in these facilities, that type of ethos does not apply. And in talking to a former detainee, the free movement of the correctional officers and the correctional staff presents this irony that if a pandemic is about restricting mobility so as to prevent the virus from traveling, deportations totally undermine that effort. But the free and unrestricted movement of correctional officers and correctional staff similarly undermines that argument. And what's more, we find that the use of masks is problematically and imperfectly adopted in institutions under the pretext of that being a security risk, because identifying individuals on a CCTV camera can be very difficult when everyone is wearing similar clothing and when everyone has a mask. And so there are some very important, potentially lethal complications about how policies are set up in these organizational settings. So thank you for that question.
Okay, I think this next question sort of ties into that one that you just answered. Aldo asks, so policies seem to throw workers, some of them unionized, into the same increased risk of contraction as the detained immigrants, except for the medical treatment that they may have access to outside of the centers. They are still being exposed to an increased risk. Or does that dynamic produce even more dehumanizing and harsh practices by staff on site?
Thank you. I don't know how to best address that, but I do want to partially share that we're still in the process of getting more information on the contractors for different healthcare services, and very importantly, the contractors that provide the tests that are being used in these facilities. So the tests that are being used as per our findings in these specific facilities are these rapid sort of antibody plus active, please don't quote me on this, on the terminology, but it's a blood-based test, a prickling of one of the digits that can produce rapid results on both antibodies and whether you ostensibly have the virus in real time. I'm unfamiliar at the top, from the top of my head of the correct name of that type of test. But part of this question of risk mitigation includes kind of regularly testing staff members and then assigning different places within a facility with people who are at risk, people who are currently infected or who test positive, and then people who are recovering and so on. Thank you for that question.
Okay, the next question is from Mauricio. Hello, I appreciate this webinar. My name is Mauricio Patino. I am a junior at Cal State San Bernardino, with a shout out to Dr. Anderson. I am currently taking a criminology course, and my question is, what can we as a society do to help prevent this problem from keeping on happening to people? You get the gist.
Thank you, Mauricio. That is the question that animated why I was a criminal justice major in undergrad, kind of trying to wrap my head around why institutions of police courts and corrections exist as they do. I hope you always ask questions like that. What can be done to minimize harms to others? That includes interpersonal harms and victimization that can account for why someone might be in jail in the first place, but it can also account for policies, practices, legal systems that generate and continuously produce even greater scales of harm. As many can tell, there is an evaluative or a normative, or kind of like there's a stance embedded in how I approach this kind of work. And it's the way that I would approach it is One of the most effective ways of reducing harm and human suffering is if the state's policies and practices didn't generate it. And so in a scenario where you have a pandemic and mobility is supposed to be restricted, in this specific context, let that principle be a little bit more consistent. And then after the context of a pandemic, we should look at things like that prison policy initiative pie chart and ask whether the human beings, who are currently behind bars, if that is really what, if that makes any sense whatsoever. A, the reasoning for why they're behind bars, and B, the kind of normalized way of just assuming that that's a natural systemic way for this concept of justice to somehow be served. So Mauricio, I don't have, if I had the answer, I don't. I don't think anybody does, but it's those types of questions that I think will animate your journey, and I'm so happy that you and your professor were able to join us. I appreciate that so much. Thank you.
Okay, the next two-part question looks like it comes from perhaps one of your students, because they first acknowledged that great to see the beard, Professor. So this is from Mark. He has two questions. The first is, how politicized do you think this wave of deportation during the COVID outbreak was, considering this administration's agenda on immigration and an election year? And the second part was, do you think this wave of deportation will set back any diplomatic relations between US and some Latin and Caribbean countries?
Mark, thank you for the question. I hope all is well. For those of us on the call, Mark is a graduate of Rutgers in New Brunswick, and he's doing his graduate studies now at Rutgers Newark in the School of Criminal Justice. So, Mark, your questions on the politicization of deportations. Pandemic instrumentalism would refer to how the pandemic is used as a pretext or as a vehicle for kind of hitching other interests on it and kind of advancing aims and objectives that might be easier or might be more doable given the context of the pandemic. And so migration restrictions are certainly implicated here. On your second question of will deportations affect diplomacy between the US and Latin American and Caribbean countries, there is, let me see if I can type something here. There's a web address that I sent that speaks in part to that on immobilities in the Americas. And there are layers to it. I'll briefly just share two. One layer is the externalization of the US border. So the US-Mexico border kind of being outsourced onto Mexico to then police the border south of Mexico to quote unquote account for the Northern Triangle migration crises in Honduras, Guatemala, and El Salvador. But if we were to look at track data, or if we were to look at data of the countries where ICE deports the most people, we would see how it aligns with a geographic project, or there are specific countries that are greatly represented as receiving countries, and also with a racial and ethnic project, a color line project. And so there's a lot there that we don't have time for in this conversation, but it is a very good question, and I appreciate you raising it.
Okay, we'll try to get through these last two, but let's see. Daniela says, is this research going to be presented to the current administration, as in Murphy's team? As a grassroots activist, we have asked Murphy to release those from ICE detention centers, and it's been a slow process. Could this research help campaigns to humanize our communities, since it seems that there was a higher release of those who are in prison for low crimes in comparison to those who are in immigration detention centers?
Yes, Daniela, thank you for that. So in short, we're not targeting Governor Murphy's administration specifically, but we are writing policy relevant papers for, and one specific academic journal where its policy focus is called Criminology and Public Policy. And this is an outlet where you can get scholarly findings to an audience of people who are in positions to act on the latest evidence-based research. So yeah, our objective is to kind of do two things at once: speak to the historical, the structural, the systemic, but also address things like some of the questions that were asked previously kind of get at, which is, what can we do this week? What can we do tomorrow? What can be done now? And what are the ways of kind of moving levers that of power and authority that currently exists to actually reduce human suffering and human harm, both as it relates to the pandemic, but also as it relates to incarceration, detention, deportation, and the inhumane features of those systems. So we are paying attention to how to share, we can share this work with those who are in positions to do something about it.
Okay, I think we have time to do the last one. And this comes from a freshman at Rutgers. They say, I have a question. I don't know if it would apply to your analysis, but I would appreciate if you could answer. We have a disproportionate incarceration rate of minorities today, and the coronavirus is killing Black and Hispanic people at higher rates. Have these prison facilities taken action in reducing the inmate population, specifically the minorities who are incarcerated?
Yeah, as I want to circle back to this phrasing, inequality accelerator or inequality magnifier. Criminal justice systems are a high visibility example of where these inequalities play out. But they're not the sole place where you'll see them. To kind of, based on our current research, I mean, we're seeing how COVID-19 has only made these race and ethnicity-based inequities and inequalities worse, like reduced due process protections and immigration proceedings. But you're touching on a subject that, you know, in any criminal justice course that you take, the faculty do an excellent job at pointing out the racial and ethnic systemic inequalities embedded at various scales of the criminal justice system. And so as a first year student, thank you for having your kind of your focus in this space. And should you take any courses that touch on criminal justice, it will be, it really is a lifelong study of this topic. And so you're pointing out something that we're grappling with, and we study and we teach as our full-time jobs. Criminologists, trained as a criminologist, we are one of the kind of professional areas of study that if we could do our jobs effectively, we wouldn't have a job anymore. And so it's a shared project. We're one of countless others across the country, academics, researchers, students, scholars, who care about these topics from different angles. And so I'm so grateful for everyone's time, the quality of the insights, questions, and critiques. And thank you again. And I hope you all have a wonderful rest of the week.
Thank you so much for taking some time. And there was lots of thank yous in the Q&A. So people really appreciated your talk today. I'd like to thank everyone who logged in and joined us. We will be sending a post-event survey later that we always ask for feedback. We will have the link to this talk on the website, on the SAS events website later this afternoon. There is a new SAS alumni feature on the SAS website that we encourage you to check out. We're going to take a little reprieve from Scarlet speakers, and we will be back again. I believe December 1st is our next event. So hope to see you then, and everyone have a nice weekend. Thank you.
Thank you.